Thank you for the introduction. As previously mentioned, the TASC project aims to provide novel understanding and up-to-date knowledge on task shifting and the transferability and uptake of good practices in implementation. The first deliverable of Work Package 4, for which I'm the Work Package lead, collections of useful tools and practices in task shifting, presents the results of an explorative study on the need for curriculum development in task shifting and provides an overview of existing good practices. We have used a mixed methods approach, including desk research of evidence in the scientific literature, findings of EU projects, as well as stakeholders interviews. This slide shows the literature review and state of the art for task shifting. From the literature, we identified 5 key points or features for successful implementation of collaborative practice. The first one was good communication between teams. The second, relevant and timely access to specialist services. 3, coordinated care and continuous support. 4, organizational climate. And 5, management support. However, the evidence suggests that education alone may be insufficient to change the culture. There is also a need to explore initiatives that affect attitudes and behaviors. From EU projects, we will use knowledge and models from the Monrose and the DISH project in the development of the curriculum and learning material. The Monrose conceptual model for task shifting recommend revising competency frameworks to enhance teamworking skills, coordination and communication skills, and to foster interprofessional training of health professionals. The DISH Learning Innovative Unit Framework for Co-creation fosters multidisciplinary collaboration, innovative attitudes and team learning, including on-the-job training to provide better development and uptake of technologies and digital solutions. The starting point should always be the needs and values both at organizational and individual levels, and shared decision-making is central in the process. So, to summarize, the academic literature review identified interprofessional education as beneficial, and shared learning may be more effective in engaging health professionals and facilitating learning. Models for collaborative learning across disciplines needs, however, further research. The main features of the successful implementation of collaborative practice are good communication between teams, and organizational climate and management support that provides opportunities to integrate the acquired skills. The review of the EU project identified that learning outcomes for task shifting should enhance teamworking skills, coordinating and communication skills, and a learning activity that will foster interprofessional training. And based on these findings, we have, according to the Bologna process, identified learning outcomes related to knowledge, skills, and competencies, as you can see in the figure on the right-hand side. And I will, in the next session, explain how we will integrate these learning outcomes into a curriculum and model for training of task shifting. Thank you. Thank you. As I mentioned in the previous section, we identified learning outcomes for a curriculum in task shifting. And for knowledge, we have identified that having evidence-based knowledge about the condition for task shifting, as well as the diagnosis and treatment, is important. To have thorough knowledge about relevant qualifications, legislations, guidelines, and protocols, as well as to have knowledge about the relevant professions, organizational healthcare, interprofessional practice, and culture. In terms of skills, we have identified to have advanced clinical and decision-making skills, advanced digital skills, advanced coordination and communication skills, co-production and teamwork skills, as well as having leader and management skills. That will lead to competency that the candidate or the health workforce can take part in task delegation and sharing of roles within health professions, between different health professions, and also in shifts to patients and machines. The next step of the task project and work package 4 is to develop a module-based curriculum and training material based on the theories for adult learning, which includes having this dissonance phase, refinement and organization feedback phase, as well as the consolidation phase for the knowledge, based on a knowledge, practice, and process model, which includes sampling and reviewing the new knowledge base, processing and linking the new and existing knowledge using a cognitive or practice-based framework, as well as sharing and making practice explicit. And we will also include an open access repository after the principle of the USN, University of Southeastern Norway, Love You project. So this figure shows an overview of the intended framework. And the TASHE project also includes work package 5, which is led by Paolo Michelutti, including 5 pilot sites. And at the moment, work package 5 are completing a needs assessment for the pilot sites. And based on these needs assessment and also bilateral meetings with each site, we will involve these pilot sites in identifying the needs and their values for the curriculum, as well as include them in the co-production and identify champions and capacities to ensure shared decision-making for on-the-job training. And the pilots includes Italy in primary care, GPs and nurses, the Netherlands, ophthalmology and optometry, Norway in advanced wound care, Lithuania, GP and mental health, and Estonia at different levels of care provision. So since we're short on time, I'll stop there. Thank you very much.